So let me know if you've noticed this. I feel like there have been a lot of videos recently about doctors who are either considering leaving medicine or they've already left. And it got me thinking, why is that? As many of you know, I left my plastic surgery residency back in 2018 to focus on my businesses, and currently one of those businesses is Med School Insiders. We have a YouTube channel, and overall we help pre-meds get into med school, med students get into residency, and then there's Memm, which is an MCAT study tool. Now, as someone who has left medicine myself, here are the reasons why I believe doctors are leaving medicine, what's changed in recent years, and most importantly, how it applies to you. Now, first off, you can't make a video about doctors leaving medicine in 2022 without addressing the coronavirus pandemic. The pandemic has obviously been incredibly stressful for both physicians and other healthcare workers. At the beginning of the pandemic, there was a lot of uncertainty surrounding the virus. So doctors were doing their best on incomplete information, trying to treat something we didn't really know much about, while trying to minimize transmission for themselves. And all industries were affected in some way or another. But with most other industries, it was decreased workload and decreased work hours, whereas doctors and healthcare workers had to work harder and work longer, oftentimes in full PPE. I mean, at the beginning, they didn't even have proper PPE. Now, on top of that, doctors aren't immune to the virus either, and many of themselves got sick or at least had family, friends, coworkers, and colleagues who did. And we know that higher viral loads also lead to more severe illness, which is pretty scary when you're the one taking care of lots of COVID patients. Not only is this stressful mentally when you're seeing just how sick people are getting and you worry about your own health and of course your family's health, but when members of the healthcare team are getting sick, you then have issues with understaffing. And now the work demands get even higher for everyone else, which makes them work even harder and longer hours. According to a recent article from Mayo Clinic, 1 in 5 physicians say it's likely that they will leave their current practice within 2 years. And about 1 in 3 doctors and other healthcare professionals intend to reduce their work hours over the next 12 months. And this is across over 20,000 respondents at more than 100 institutions surveyed between January 1st and December 31st of 2020. Another article from September of 2021 compared Medicare data between April 2019 and April of 2020. And what they found is that nearly 3 times as many doctors who experienced practice interruptions in 2020 decided not to return to clinical practice compared to those back in 2019. Now, despite these alarming statistics, it's still actually difficult to say for certain, definitively, if more physicians are leaving medicine now than back in the past. We don't have that data. Now, although the pandemic has definitely been a catalyst for many doctors leaving medicine isn't actually a new thing. Doctors have been leaving medicine long before the pandemic ever started. In fact, I can think back to several of my friends and colleagues who quit medicine when I was either in medical school or in residency. Actually, that gives me an idea. Do you want me to make a video going over the various career options after leaving medicine? If so, let me know with a comment down below so I can gauge interest. So a big part of the reason that doctors were leaving medicine is just burnout amongst med students, residents, and physicians. And this has been a big issue for a long time. Even going back to 2015, long before the pandemic, 46% of physicians reported feeling burned out. Compared to this year, the numbers are nearly identical at 47%. And the top reasons for burnout from 2015 to 2022, they're more or less unchanged. Too many bureaucratic tasks, lack of respect from administrators, too many work hours. In short, doctors are being exploited by the healthcare system. There are a lot of other industries that treat their employees much better than healthcare. So take computer science and programming, for instance. They're fighting over the top employees at these big tech companies and trying to incentivize them to work there and keep them there. And the reason is that it's much more important for them to get the top talent because the work they're doing scales rapidly at a near zero cost of replication. That's just the nature of code and programming. But in medicine, it's not quite as critical to get that top talent because the differences between having a top performing doctor and a lower performing one aren't as pronounced for the end product and business success for the hospital. So the hospitals and healthcare systems are not really incentivized to do that. That's why you never see hospitals fighting for top physicians and bending over backwards with benefits and perks to keep them happy. A big part of doctors leaving medicine has also been the disparity between expectations and reality. Oftentimes, society idealizes doctors and puts the career on a pedestal. They think, hey, it's an amazing job, you make great money, you get to help people. I mean, what more could you want? And don't get me wrong, medicine is a wonderful career, but just like with anything else, there are definite pros and cons. It's not all sunshine and rainbows. People don't often consider things like how long it takes to become a doctor. So you got 4 years of undergrad, plus 4 years of med school, plus 3 to 7 years of residency, plus fellowship if you decide to do that. And that's obviously a massive opportunity cost in your prime years, or how difficult the training is to become a doctor with pre-med, med school, and residency. You're studying a lot, you're grinding a lot, you're working really challenging hours, or how expensive medical school is. The average medical student graduates with over $200,000 in debt, but some have more than 500K. Then of course you have the long hours as an attending to pay back your student loans, and then the stress of being responsible for other people's lives and making decisions that could be really life-changing, both good, of course, but also bad. And then there's the administrative burdens and the bureaucracy and yada, 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 it goes on. What you end up though is a lot of people who go into medicine with certain expectations and then bam, reality just smacks them in the face. It's not what they expected it to be.
What did the 5 fingers say to the face? What? Slap!
This is actually a big part of what I try to do on both this channel and Med School Insiders. I want to show people, particularly pre-meds and med students, what it's actually like to be a doctor, both the good and the bad, so then you can make an informed decision of whether or not it's a good fit for you. There's lots of videos on both channels, but the Day in the Life series on this channel and the So You Want to Be series on the Med School Insiders channel, both great places to start. So if doctors have always been leaving medicine, why are we hearing more about it now? It comes down to transparency. It's actually difficult to say whether more doctors are leaving now for certain because the data is limited, but what has changed for sure is the transparency around leaving medicine. So before, if you were thinking about leaving medicine, it was all very hush-hush. People were leaving, but you just didn't hear about it. So it seemed like fewer people left. There was also a bit more of a stigma back then about leaving, so it would have either deterred people from leaving, or if they did, then they wanted to keep it on the DL. And then of course, going back to the whole societal expectation versus reality, people go into medicine with certain expectations, and if the reality is a lot different, some of them may say, hey, this is just not worth it. But a lot of people, they feel stuck. And actually with social media, I feel like a lot of people just give you the highlight reel of how amazing it is to be a doctor, and only now we're starting to see more and more people come out about the issues that they're having with medicine. Now that we have the internet, social media, YouTube, Instagram, there's a lot of people who are leaving and they're being very transparent with their decision and with their reasoning. You know, I was one of those people. And overall, this is a great thing because it's helping other medical students, other doctors out there see that these people left medicine and they still had options. They went on to live successful and meaningful lives. Now this brings me to identity, and I feel like we oftentimes place too much of an emphasis on identity, and it's human nature. Like, we need to categorize people, things, ideas. We put them into boxes because that's how we make sense of the world. If we didn't do that, it would just be sensory overload. So we need this pattern recognition to survive. But the issue is that it often makes us hold too tightly onto our identities, and then it limits what we are actually able to do. Oh, I'm a doctor, therefore I can't quit and become an entrepreneur. That's not possible, that's not who I am. And then there's of course the sunk cost fallacy. So you have pre-meds and residents and attending physicians. They think about how much time and effort and money they've invested into becoming a doctor, and they think that by leaving it, they're gonna just throw all that away. It's gonna be wasted effort. So this sunk cost fallacy and identity, I think, are contributing to a lot of med students and physicians feeling stuck. But if you think back to before med school, before residency, there were a lot of things that interested you, and the reality is that those interests are still there. We just forget about them because we hold on so tightly to these newly formed identities. So overall, this increased transparency is awesome because it's showing people out there that you aren't stuck. There are other routes that you can pursue. One of those routes is of course entrepreneurship. So many doctors, myself included, left medicine to become entrepreneurs and business owners. And because of the internet, it is easier now than ever to start and scale a successful business. And entrepreneurship is dope. You get to make a difference, help people, and make a good living without being a clinical physician. With entrepreneurship, you can actually even scale that and help many more people on a much larger scale than just treating one patient at a time. Entrepreneurship also makes sense as a logical solution to burnout because a lot of the issues that we talked about as causing burnout can be addressed with entrepreneurship. That's because as an entrepreneur, you are in control. You get to choose what you do and how you do it. You don't have to deal with bureaucracy and crazy admin because you're the boss. You don't have to worry about reimbursement rates from insurance companies, which have been going down for years. You can do things your own way, and I mean, it's a riskier and I would say a more exciting life as an entrepreneur. But obviously there are a lot of downsides, namely the risk, and there is still a risk of burnout because you gotta work pretty hard in most cases to be successful as an entrepreneur, especially at the beginning. But if you're smart enough to become a doctor, you are definitely smart enough to be a successful entrepreneur. You might have some failures along the way, and that's totally normal. I've had my failures too. But in the end, I think many of us have greater entrepreneurial abilities than we believe because of our doctor identities. So overall, doctors have always been quitting medicine. They will continue to quit medicine. And what we're seeing isn't necessarily anything new. I would argue that the main thing is actually increased transparency about leaving thanks to social media. And look, I'm not trying to poo-poo on medicine. I think medicine and being a doctor is a wonderful career, And there are a lot of unique pros to it that you just can't really find in other careers. Just because it wasn't right for me or some of these other doctors that are leaving doesn't mean that it isn't right for other people. Maybe it's totally right for you. I do, however, think that medicine is pretty overhyped. So if 100 pre-meds want to go into medicine, go to medical school, maybe it's right for 75 of them, but it's probably not right for the other 25. And that's because, again, this disconnect of expectation from reality. Just like with any career decision, it's important to know exactly what you're getting into before you commit so that you don't end up feeling stuck later down the road. So if you are considering medicine, it's on you to do your research, get the experience, determine whether or not it's the right fit for you. And again, the Day in the Life series on this channel or the So You Want to Be series on Med School Insiders are great places to start. And if you do find that it's not for you, don't feel guilty about changing your mind. And don't let other people tell you what you should or shouldn't do, especially your parents. Parents do want what's best for you, but forcing you into a career that you don't want to do isn't actually good for your long-term happiness. Do what's right for you and what makes you happy, and don't judge anyone else for doing the same. The average person spends about 1/3 of their lives at work. That's about 90,000 hours over the course of their life. And life is just too short to spend all that time doing something that doesn't make you happy. Much love, my friends, and I'll see you in that next one.